Hello and good day. My name is Brandon Nelson, and I'm excited to be talking to you today about the implementation and adoption of artificial intelligence in healthcare. Healthcare still lags behind many other industries with the adoption of artificial intelligence and machine learning, but according to Davenport and Meidel, life sciences and healthcare companies are poised on the edge of dramatic transformation driven by artificial intelligence. However, they are not quite there yet. And why are they not quite there yet? A lot of it has to do with the access to data. It's one of the biggest challenges. Collecting data in healthcare industry is poor, and it's not very clear. And the reason for this are many. For instance, many healthcare organizations use different types of electronic health records or electronic medical records called EMRs. And EMRs can vary from organization to organization and also internally different. They can have different types of EMRs. And within these different EMRs, there's different discretionary fields and how you enter information. And a lot of these EMRs are upgraded on a regular basis and they change the fields. And so it makes our data analysts have to go in and pull information in different ways. And it just really compounds the issue of trying to get good, clean data. But still, there are a lot of opportunities for artificial intelligence today to help support healthcare. And so I wanted to try things a little bit different today. Because I am a nursing executive for Sutter Health, which is a large integrated healthcare system in Northern California, I actually wanted to share with you some of the challenges that we've experienced and how we're leveraging technology to address our patients' concerns. The first problem that we have been trying to address has been building up for a while. Back in 2013, when I first joined the organization, the company was going through a campaign called The Doctor is in Your Box. This is great. It really connected us with our patients. But what started happening is the patients really took hold of this and they started to expect that the doctors were really in their inbox, meaning that they would respond almost instantaneously with messages and help. This actually um, mushroomed over time and the volumes just grew. And as a result, what we found 10 years later is that our clinicians spend a lot of time after hours following up on messages. And this is something that we call pajama time. And it leads to a decrease in life work balance because they're spending so much time answering patients, they don't really get a downtime at the end of the day before they have to come back to work the next day. As a result, they've decreased the number of appointments that they've used because they're using some of their daytime hours to get to messages and to charting, which decreases compensation to the clinicians and overall to the organization because they're seeing fewer patients. And a lot of these messages that are coming in, patients are asking for free advice. And so the company and the doctors aren't getting compensated for those messages. We've also had to increase the number of staffing to help cover these messages, but still it continues to mushroom. And what this has led to is increased burnout. So enter into one of our first solutions, which is our programmatic wizard. Say, for instance, you have a medication that you take on a regular basis. Today, we will use the medication Viagra. And yes, this is something that we refill on a regular basis. So prior to the use of our programmatic wizard, all medication requests would go to our doctors. And our doctors would have to see that, review it, sign it off. But now, if you have a medication that you need refilled, you can call in to the doctor's office, you can send a message, you can send a message to the pharmacy, or the pharmacy knows that it's time for you to get new medication. And so that comes into our system and it's converted into an encounter, and that encounter goes through our electronic medical record, and there's an algorithm that looks at your chart and it looks if you've visited with the doctor recently, if you have all your labs up to date, and if you do, it meets criteria. It actually gets sent to the registered nurse. The registered nurse reviews it, kind of same thing that the wizard does, but we're just verifying that it's accurate. And if it is accurate, the RN can simply reorder it without the doctor even having to see it because the RN is following the algorithm and they're working under what's called a nursing standardized procedure. If you haven't seen the doctor that in the past year, that message will actually go to the medical assistant. Medical assistant will call you, schedule an appointment. Usually we'll send a message to the doctor as well to get you a medication refill. But the MA gets you into the office to meet that criteria. If you haven't had labs, then the MA will create an order for the physician, send it to the physician, and the physician will sign it so you can get your labs done. Or if you have a medication that's out of scope, such as like opioids, that usually just goes right to the clinician. But the benefit of this is that we've been able to touch 10,000 prescriptions a month for our RNs to do that our physicians don't have to do. Still, this only represents about 30% of the medications that come into the organization each month. The next really cool solution that we're looking at for messages for our patients is our clinicians are actively training machine learning to respond to patient messages. This is really cool. We're starting very simply with a few things such as if a message come in that says, "Hey, thank you for the advice," our artificial intelligence can address that. But our physicians are actively looking at how we can expand this use of artificial intelligence. And why use artificial intelligence? A study out of UC San Diego showed that ChatGPT actually responded more effectively and with more empathy than did their physician counterparts. Now, the study was limited. It was only a panel of 3 doctors who were blind to the questions and the responses from both the doctors and the artificial intelligence. But they did look at 200 different questions that came in, and you can see here that, wow, the artificial intelligence actually outperformed the doctor. So the way this works is it comes in, it'll type up a message, it actually goes to the doctor before being sent back out to the patient. So the doctor is actually reviewing that information and validating that what the artificial intelligence is putting that message is accurate. The next problem that we are looking at is how do we get doctors out from behind the computer so that they're able to focus on their patient in the exam room instead of being behind the screen. A new technology that we're just on the cusp of looking at is called a Deep Scribe or Dragon Ambient Experience. These are actually 2 different companies. And basically it's simple. A doctor walks into the office, uses their phone, pushes a button, and it begins recording what the doctor's saying. Now the doctor simply has to talk to the patient. How are you doing? Can you breathe for me? Okay, your lungs sound normal. And then what the artificial intelligence does is it takes that information and it puts it into a chart note. And then at the end of the day, the doctor simply has to go in and review it and see if it's accurate, and then they simply sign it off. With the end results that the companies are saying that you can save up to 3 hours a day for the clinician to do all this charting. And if you can save 3 hours a day, what else can you do with your day? Can you see more patients? Can you get more time with your family? And that's ultimately what we want for our doctors, because we want to keep our doctors. We don't want to burn them out. And so really we're using technology to help provide quality patient care, but to also support our clinical teams to maintain a high level of care to our patients. I know that was really fast. We have several other technologies that we're looking at, but this is just one reason why it's really exciting to be in the healthcare industry and to see where we're going with technology. Thank you for your time.